Senator Patty Murray, a veteran champion of women's health from Washington state, sat across from Dr. Casey Means, President Trump's pick for Surgeon General. Now, Dr. Means is not your typical nominee for America's top public health post. She's a wellness influencer with a history of eyebrow-raising claims about birth control and a troubling closeness to the administration's anti-science wing. Murray, armed with facts and FDA data, pressing a nominee who seemed far more comfortable with talking points than with the truth.
Senator Murray.
Thank you, Mr. Chairman. Thank you, Dr. Means, for being here. Let me start with this. You called birth control pills, and I'm going to quote, a disrespect of life, and you said Americans, quote, use birth control pills like candy. You also claimed, contrary to established science, that hormonal birth control has, quote, horrifying health risks for women. Now, here are the facts. There are 18 FDA-approved contraceptive methods, both hormonal and non-hormonal, and there are decades of evidence showing that every one of these birth control methods is safe and effective. So I wanted to ask you, help me understand, should women trust the FDA, which approved all 18 methods of birth control after a very rigorous look at the evidence, or should they trust your statement that there are horrifying health risks to birth control, which contradicts that evidence?
Thank you, Senator Murray, for your question. I'm curious if you're aware of what the side effects of hormonal contraception are.
I'm curious if you are with the FDA that went through all of these and rigorously looked at them, or as Surgeon General, if you're going to tell the truth to the American people.
I absolutely believe these medications should be accessible to all women. And also, all medications have risks and benefits, and in our current medical climate, with the burden on doctors, doctors do not have enough time for thorough informed consent conversations. Some of the horrifying side effects of birth control that I have mentioned include blood clots and stroke risk in women who have clotting disorders, who are smokers, who have obesity. No, it's not general. I'm very careful with my words, and when I say those comments, which are taken out of context, I'm speaking about particular women that can be hurt if there is not informed consent about their medical history, their lifestyle exposures, and their family history. I want those women, and I know you do too, to be able to have a thorough conversation with their doctor and know whether they are at higher risk for side effects when prescribed the medication.
Saying that is one thing, but saying on different shows that birth control pills are a disrespect of life is very different.
I am passionate about women's health, and I think it is disrespectful
people use
to women.
Birth controls like candy is very different than what you just said.
We prescribe a huge amount of hormonal contraceptive, and I do not believe most of those conversations have informed consent because of the pressures that doctors are under because of our broken healthcare system. I want what's best for women, as do you, and I want every woman who could be at risk for a side effect.
2 minutes left, and I have other questions. Let me move on. Thank you.
If a woman died from a stroke or a blood clot because they did not have a thorough conversation.
Thank you for your answer. You made that clear. Let me go to another question. Tracy Beth Hogue, she's an anti-vaccine skeptic. She was elevated by the Trump administration to serve as the top drug regulator at FDA. She made comments last week casting doubt on the safety of RSV vaccines for baby. As you I'm sure know, RSV can be deadly even for healthy full-term infants. Do you believe that Dr. Hogue is wrong to question the safety of RSV vaccines?
I have not read that article or seen that quote. I would need to know what she said before I commented on that.
Well, you do know that RSV is the leading cause of hospitalization for infants.
I have a 17-week-old, and I'm very aware of that.
You hear her statement. As Surgeon General, would you contradict it?
I certainly have absolutely no issue having very frank conversations with anyone in the administration if I believe that their statements are misguided in some way or not fully informed. That's not a conversation I would have publicly first. I would have a private and direct conversation with anyone in the administration if I felt that patients were at risk because of.
All right, and I also want to ask you about maternal health. Mental health conditions are the leading cause of maternal death in the U.S., including suicide and overdose deaths. In her comments last week, Dr. Hogue, same woman, also expressed concern about the safety of the antidepressants during during pregnancy. Specifically, she called out SSRIs, the most commonly prescribed type. Do you believe that SSRIs are dangerous for pregnant women?
I don't want to be a broken record here, but I do believe that every medication has risks and benefits, and you need to have a nuanced conversation with your doctor before starting a medication. That is, I think, the most responsible position for any doctor to share.
Well, strong evidence has shown that SSRIs are safe in pregnancy. Most do not increase the risk of birth defects.
Certainly.
But untreated
Certainly.
depression in pregnancy puts women at risk.
And I agree with you, but I still think a patient, I don't think it's responsible to make a blatant statement for all Americans.
Okay, well, if confirmed as Surgeon General, it will be your job to give accurate and up-to-date health information to the American people. I assume you will take that
I will.
responsibility seriously.
I absolutely do. And I also believe that the American people are looking for a more nuanced conversation about health. And I believe that that will help restore trust in public health.
Thank you.
Senator Patty Murray, one of the longest-serving women in the United States Senate, a lawmaker who has spent decades fighting for reproductive rights and women's health care, came to this hearing with receipts, direct quotes, FDA data, established medical consensus. And what did she get in return? Dr. Casey Means wants you to believe that her past comments calling birth control a disrespect of life, saying Americans pop contraceptive pills like candy, describing FDA-approved medications as carrying horrifying health risks were simply taken out of context. That's become the go-to defense in this era of accountability. I was taken out of context. All medications have risks and benefits. That is, of course, true. Every doctor knows that. Every pharmacist knows that. It's printed on every medication label in America. But that's not what she said on those podcasts and interviews. She didn't offer measured medical guidance. She used inflammatory language designed to sow fear and distrust in contraception. And there is a world of difference between informed consent and ideological fear-mongering. Senator Murray raised the case of Tracy Beth Hogue, a known vaccine skeptic, now serving as a top drug regulator at the FDA, courtesy of this administration. A woman who publicly questioned the safety of RSV vaccines, vaccines that protect newborn babies from a virus that fills pediatric ICUs across this country every single winter. Dr. Means' response? I haven't read the article. The woman nominated to be America's doctor, the nation's top voice on public health, hadn't bothered to read about a senior FDA official casting doubt on infant vaccines. And when asked about SSRIs, antidepressants that are a lifeline for pregnant women battling depression, medications backed by strong clinical evidence, Dr. Means once again retreated behind the same wall of vague caution. Every medication has risks and benefits. It's a phrase that sounds responsible until you realize it's being used to avoid saying anything at all. Here is the fundamental question this hearing raised. What happens when the person charged with telling the American people the truth about their health is someone who has built a brand on questioning that very truth? The Surgeon General is not a podcast host. The Surgeon General is not a wellness influencer. The Surgeon General is supposed to be the one person in government that every American, regardless of party, can trust to give them straight, science-based health information. Senator Murray closed by reminding Dr. Means that if confirmed, it would be her job to provide accurate, up-to-date health information to the public. Dr. Means said she would. But her record, her own words, in her own voice, on camera, tells a very different story.